You may have been told you need a knee replacement. The goal of this video series is to guide you through that worrisome process. Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and a hip and knee replacement specialist. There are many causes that may result in you needing a knee replacement. And though osteoarthritis is the most common, if you haven't viewed it already, our section on arthritis may be useful to you. A knee replacement is a trusted operation with a long track record of reducing pain and restoring function. The operation is designed to help you walk better, to sleep better, and to get you back to all the activities you want to be doing again. In order to understand more about the replacement, let's start with the normal knee. What is the knee's anatomy and function? From a basic point of view, you and I know that a knee is a hinge joint. It goes from bent to straight like that. But a knee is so much more than just a hinge joint going from straight to bent. It also rotates very slightly. It goes into extension and compression, and it also shifts from side to side. All those movements have to be replicated by a knee replacement. When you look at yourself in the mirror, you may have noticed that your legs are becoming knock-kneed or bow-legged. Maybe you can't get your legs out straight. The other purpose of a knee replacement is to straighten the leg out and to give you better alignment. The knee is made up of the thigh bone or femur and the shin bone or tibia. The two bones are normally lined by a thin, shiny layer of cartilage, the protective, smooth layer over the bone. And that can become worn away in arthritis. That may be what's causing the pain. The focus of a knee replacement is to shave away the diseased arthritic bone and then to replace it with a new surface. The operation is really a resurfacing procedure. But before we get there, we have to make a surgical incision to get down to the knee joint. The kneecap is moved to the side, and this exposes the bones that will resurface. The bottom of the thigh bone or femur will be shaved a few times, and this allows a femoral replacement to perfectly slot on. The implant is usually made of strong and smooth metal. Your surgeon will choose an implant that's the right size for your body. Don't worry, they'll have every size available. The implant may be secured by a special bone cement, or sometimes it has a special coating on the back that helps the bone grow into it. Similarly, the shin bone or tibia is shaved and it's resurfaced with a metal tray. The metal tray, again, is cemented or has a coating which lets it grow on, and then a special plastic liner called polyethylene is placed on top of that. This polyethylene is incredibly smooth and it allows the femur to glide effortlessly and allows that motion to occur. And just like the natural knee, it allows some rotation and some side-to-side motion as well. Once those implants are in, the kneecap is put back in place. Many surgeons will resurface the back of the kneecap with polyethylene, although that's not always necessary. Your surgeon will make sure the knee is well balanced and that the kneecap glides nicely. They'll then check that your knee bends all the way back and straightens out fully. Once your surgeon is satisfied, they'll close up the wound in a few layers. Some surgeons will use special metal skin staples. These will need to be removed a couple of weeks later. Some surgeons will use stitches that absorb over time and a glue or a mesh. After the operation, as soon as you're awake in the recovery room, you'll be encouraged to start moving the knee as much as possible. Just remember, as soon as the knee is placed in, it won't fall out. So you have to push it as much as you can. Next, we'll talk about your recovery, as well as some of the risks of operation. Joint recovery is your daily, at-home, physio-guided rehab program. you'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.